There should never be a federal agent in a medical exam room, but over the past few months, while working in the hospital, I've had multiple ICE agents sitting in the room while I talk to my patients. Not outside the hospital, not in the hallway, in the room. My name is Dr. Joel, the Medical Mythbuster, and today let's talk about ICE, hospitals, and why this is becoming a public health issue. Twice in 1 week, I took care of patients transferred from ICE detention centers. In both times, ICE agents stayed in the room, listening, taking notes, even sometimes interjecting. That immediately raised concerns for me about privacy, consent, and the power dynamics at play, especially when language barriers were involved. So I looked into the law, but what I found wasn't clarity. There are clear protections for patient privacy under HIPAA. There are longstanding norms about hospitals being sensitive areas. But what I found is there's far less legal clarity when someone is already in federal custody and being given medical care. And ambiguity is where harm often lies. And unfortunately, this isn't isolated. Over the past few weeks, reporting out of Minnesota has documented ICE agents in hospitals, specifically in patient care areas. Doctors and nurses there are describing an environment where patients are delaying care, rationing medications, or avoiding the hospital altogether to avoid immigration enforcement. That's the moment this stops being a political debate and becomes a public health issue. Hospitals rely on trust. Patients have to be safe enough to feel like they can literally divulge some of the most vulnerable information of their life. When enforcement enters that space, it fundamentally changes that interaction. And it doesn't just impact undocumented patients, it impacts everyone when we start to have to wonder whether care comes with consequences. So when we talk about ICE, we can't just limit conversations to borders or detention centers. We have to ask, what happens when enforcement enters spaces that are meant for healing? What does that do to already eroding trust, to outcomes, to those who feel safe enough to seek care at all? This isn't just about immigration policy. It's about whether healthcare remains a place of care, whether it becomes another site of surveillance.